Health Novo presents Sushruta, our health awareness channel.
How to maintain oral hygiene after any dental procedure. So let's enumerate the procedures. From the childhood, the first procedure is dental cavity and the filling. As you grow older, the procedure is gum treatment, cleaning, polishing, etc. Sometimes you have to remove the tooth. So what are the instructions and how to follow, maintain after extraction? Then we put dentures, implant, bridge. There are a lot of procedures which have been done for the disease you have in the oral cavity. There are some cosmetic procedures which we do like tooth whitening, bleaching or laminate veneers. So how to maintain after the treatment is over. So let's start from the child cavities. Cavity is a hole, like you see here. The cavity is a hole. And we fill that cavity, and after filling, doctors gives you instruction, dentists give instruction not to eat for 1 hour or not to eat hard stuff after maybe at least for 2 hours, etc. So that you have to follow. If you do silver filling for elderly or you do composite, that is cosmetic filling, they will give instructions when to start eating, what not to eat. Instructions immediately after doing the procedure is very important. Once the filling become part of the tooth, then the maintenance is brushing, flossing and visiting dentists every 6 months to 1 year to see if there is small crack, fracture, which then becomes big. But if you go in time, they can stitch in time and you don't have to spend time, energy, money for the same procedure. Then we talk about gum treatment. Simple cleaning maintained by brushing properly, flossing, massaging your gums. If you got a major treatment where you have to do gum surgery, then doctor will tell you to massage, and instead of coming every 6 months, they might call you every 3 months. Then there are instructions about what not to eat for a couple of months, because if you eat very hard, the teeth start moving. So after gum treatment, the instructions are different, is to maintain. At the end, I will show you brushing, flossing, etc. Then at the age of 11, 12 to 18, people usually put braces. Now braces are some brackets which are metal or ceramic on the tooth surface. So if there is anything on the tooth surface, immediately plaque, which is a soft food particle, stay around the bracket. And if it is not cleaned properly, you get cavities around the bracket. There are a lot of young patients, after remove bracket after 2 years or 4 years, you see white spots, which is called decalcification. That becomes into a cavity later on. So once the braces is on, the post-operative care is to brush properly, as the orthodontist will tell you. There is a special brush for brackets. Use fluoride toothpaste, which is more fluoride, so that it become acid resistance and the cavity will not take place. And regularly show to your general dentist, not orthodontist, general dentist, if there is any plaque accumulation, to brush that area with our dental brushes which we use in the clinic. After the braces are out, the most important instruction post-operative care for the braces is retention of the teeth which have been shifted. If your teeth were out and were shifted in, they give you a retainer plate or they put a single wire called permanent retainer. Please don't neglect that stage, because teeth goes in and if you don't retain, they will come out in a different way. So retainer is very, very important. If you remove a tooth, extracted the tooth, doctors gives you a post-operative care. when to start eating, when to eat cold, hot, etc. They will tell you. But a post-operative care or post-operative maintenance after extraction of any tooth is replacement. If you don't replace your teeth in time, you get a headache, back pain, neck pain, shoulder pain. That is called TM joint problem. I did my thesis for my master's and I found 39.9% of patients having headache had missing teeth not replaced in time because your bite changes. When I close your mouth, this is a fixed jaw, close your mouth, and if it's not fitting well, the jaw shifts. As the jaw shifts, the muscles go in different position, muscles go in spasm, neuromuscular pain, ear, and then ear. So post-operative care after extraction, the most important is replacement of it.